Most people who are diagnosed with colon cancer will tell you the same thing when you ask them about the months before their diagnosis. They notice something, a change they could not quite name, a symptom they mentioned once and then dismissed, something their body was doing differently that they attributed to aging, to stress, to something they ate. They did not know, because nobody told them, that their body had been sending a specific, recognizable set of signals for up to 6 months before the cancer showed up on a scan. Signals that, if recognized and acted on, could have moved that diagnosis from stage 3 to stage 1. And that difference, that single staging difference, changes the 5-year survival rate from 40% to 92%. I am Dr. Edward, and in this video, I'm going to give you the 7 warning signs of colon cancer that appear in the months before diagnosis, signs that are not the obvious ones you have already heard about, signs that are routinely dismissed as normal aging, signs that your body is producing right now if something is growing in your colon, whether you can feel it or not. I am going to explain the biology behind each one so you understand not just what to watch for, but why your body produces that signal and what it means. And I am going to tell you exactly what to do if you recognize any of them in yourself or someone you love. Before anything else, what you are about to hear is educational information based on published scientific research. It is not a substitute for personalized medical care. If you have a personal or family history of colon cancer, inflammatory bowel disease, or any gastrointestinal condition, please work with your doctor directly. Nothing in this video replaces a clinical evaluation. Use this information to have a better conversation with your physician, not to replace one. And if you are watching this and you are not subscribed to this channel, please do that right now. I cover the early warning research that annual checkups do not have time to explain. It is free and it takes 2 seconds. Subscribe and then stay with me, because what I am about to show you genuinely saves lives when it reaches the right person at the right time. Let me start by telling you something about colon cancer that most people do not know, because understanding this changes how seriously you take every single sign I am about to describe. Colon cancer is one of the slowest developing cancers in the human body. Most colon cancers begin as small, benign growths called polyps, clusters of abnormal cells on the inner lining of the colon wall. A polyp can exist for 5 to 10 years without causing any symptoms, without being detectable on a physical exam, without triggering anything that would lead a person to a doctor. It sits there, growing slowly, going through stages of cellular change. But here is the critical window. In the months before a polyp crosses the threshold from benign to malignant, and in the months after it becomes cancerous, but before it reaches a size visible on imaging, your body begins to respond. Immune cells detect the abnormality, the local tissue environment changes, blood supply shifts, hormonal and inflammatory signals go out, and some of those signals produce symptoms, quiet, easy to miss, entirely attributable to something else symptoms that are your body's attempt to tell you something is wrong. A study published in the journal Gut analyzed symptom records in 2,800 patients who were subsequently diagnosed with colorectal cancer. The researchers looked backward from the diagnosis date and identified the first recorded symptom in each patient's medical history. In 67% of cases, at least one recognizable warning symptom had been documented by the patient or their doctor in the 6 months before diagnosis. 67%. 2 out of 3 colon cancer patients had a signal their body was producing that, had it been recognized and acted on, could have led to earlier detection. Most of those signals were not acted on because nobody told the patient what they meant. That is the conversation we are having right now. The first warning sign is a change in bowel habit that persists for more than 2 weeks. And I need to be very specific about what I mean by change, because this is the warning sign most commonly dismissed. I am not talking about a few days of diarrhea after a restaurant meal. I am not talking about constipation after a long flight. I am talking about a new pattern, something your bowel is doing consistently that it was not doing before, that has been present for 2 weeks or longer without a clear identified cause. That pattern could be looser stools than usual. It could be more frequent trips to the bathroom. It could be the opposite, a new consistency of constipation when you did not previously have constipation. It could be a change in the shape of your stool, thinner, more pencil-like, which occurs when a growth is partially narrowing the passage through the colon and the stool is being compressed as it passes. Any of these, persisting for 2 weeks or more, requires a conversation with your doctor. Not because it is certainly cancer, the vast majority of bowel habit changes are not, but because it is a signal your body is producing that needs an explanation. The biology behind this sign is straightforward. A mass in the colon wall affects the mechanics of the bowel at that location. It changes how efficiently the colon contracts around its contents. It can partially obstruct the lumen, the interior channel, causing stool to either pile up behind it or to pass through in an altered form. The surrounding tissue, responding to the abnormal cellular activity, alters its water absorption and secretion patterns. All of this produces a change in the output that the person can observe if they are paying attention. The second warning sign is rectal bleeding or blood in the stool, but not the kind most people think of first. The most commonly recognized rectal bleeding is bright red blood that appears visibly on toilet paper or in the bowl. That is a sign most people notice. But the more insidious form is what clinicians call occult blood. Blood present in the stool in quantities too small to see with the naked eye, but measurable on laboratory testing. This is why fecal occult blood testing exists as a screening tool. A tumor in the colon, as it grows, develops a blood supply. Its surface is fragile. As stool passes over it, small amounts of blood are deposited into the stool, amounts you will never see, but amounts that accumulate over time and produce other downstream effects including fatigue, paleness, and reduced exercise capacity, all of which I will discuss shortly. When blood is visible, it is important to understand what the color tells you. Bright red blood typically originates in the lower colon or rectum. The blood has not traveled far enough through the digestive system to darken. Dark red or maroon blood, or blood mixed within the stool rather than coating it, typically indicates a source higher in the colon. Black, tarry stools, a consistency described clinically as melena, typically indicate bleeding in the upper gastrointestinal tract, the stomach or small intestine, where the blood has been partially digested and oxidized during its transit. Any of these presentations deserves medical evaluation. Many people attribute rectal bleeding immediately to hemorrhoids, and hemorrhoids are the most common cause. But hemorrhoid bleeding does not cause invisible occult blood, does not cause the systemic fatigue and anemia pattern that colon cancer produces, and does not change bowel habit. If you have visible bleeding and any of the other signs I am describing, do not wait. Before we go further, I want to pause for a moment. If something I have already said has made you think of a symptom you have been noticing and dismissing, I want you to write it down before this video ends. Write down what it is and when it started. That note is what you bring to your doctor. And if you want this channel to keep giving you early warning information like this every week, please subscribe right now. I publish this research specifically because I believe informed seniors make better health decisions. Subscribe and help me reach more of them. The third warning sign is unexplained fatigue, and I want to distinguish this carefully from ordinary tiredness because this specific fatigue has a biological signature that sets it apart. The fatigue associated with early colon cancer is the result of chronic low-level blood loss from microscopic tumor bleeding. Every day, small amounts of iron leave your body through your stool. Over weeks and months, your iron stores become depleted. Your bone marrow cannot produce red blood cells at the rate your body needs. Hemoglobin falls, and the result is iron deficiency anemia, a measurable, detectable condition that produces a very specific kind of exhaustion. It is not the fatigue that sleep fixes. It is the fatigue that is present the moment you wake up, that makes climbing a flight of stairs feel disproportionately hard, that makes you short of breath with exertion that never bothered you before. It is the fatigue that develops slowly, over months, so gradually that you normalize it rather than flag it as something new. A study published in the British Journal of General Practice analyzed the presenting symptoms in over 10,000 patients who were subsequently diagnosed with colorectal cancer. Unexplained iron deficiency anemia without an identified cause was present in 11% of patients in the 6 months before diagnosis. In adults over 60, unexplained iron deficiency anemia, anemia that has no obvious dietary or menstrual cause, is a red flag that requires colonoscopy, not a multivitamin. A colonoscopy. If your doctor finds that your hemoglobin is low and your iron stores are depleted and you have not had a recent colonoscopy, that investigation needs to happen. The anemia is not the problem. The anemia is the signal pointing toward the problem. The fourth warning sign is abdominal discomfort, cramping, gas, or a feeling of fullness that is new, persistent, and not clearly linked to specific foods or meals. I want to be careful here because abdominal discomfort is one of the most common symptoms in the general population, and the vast majority of it has nothing to do with cancer. Irritable bowel syndrome, lactose intolerance, food sensitivity, stress, all of these produce abdominal discomfort. What distinguishes the discomfort worth investigating is three things. It is new, meaning it is not a symptom you have lived with for years. It is persistent, meaning it does not resolve with dietary adjustment or time. And it is accompanied by at least one other sign from this list. A single isolated symptom is rarely sufficient cause for alarm. A pattern of two or more new symptoms, persistent over weeks to months, is a pattern that requires investigation. The biology here involves both mechanical and inflammatory mechanisms. A tumor growing in the colon wall affects the normal coordinated muscle contractions, called peristalsis, that move contents through the bowel. The surrounding tissue responds to the abnormal cellular environment with inflammation. The local immune response releases cytokines, signaling proteins, that can cause cramping, bloating, and altered gas production. These are not dramatic symptoms. They are quiet, easy to rationalize, easy to blame on diet or aging. That is precisely what makes them worth paying attention to. The fifth warning sign is a feeling of incomplete evacuation, the persistent sense after a bowel movement that you have not fully emptied. Clinicians call this tenesmus, and it is one of the more specific warning signs in this list. When a mass is present in the lower colon or rectum, it occupies space and triggers stretch receptors in the bowel wall that signal the brain that evacuation is incomplete, because from the bowel's mechanical perspective it is. There is something present that is not moving. The sensation can be mild, just a vague sense that something is left behind, or more pronounced, producing repeated trips to the bathroom that produce little or nothing. Like the other signs in this list, tenesmus has other causes, including inflammatory bowel disease and pelvic floor dysfunction. But in a senior who is experiencing this sensation for the first time, without a prior history of bowel problems, and in combination with any other sign on this list, it requires direct medical evaluation. The sixth warning sign is unexplained weight loss. I define this precisely: a loss of 5% or more of body weight over 6 to 12 months, without a change in diet, without an increase in activity, without an identifiable cause such as a new medication or a period of significant stress. In the context of early colon cancer, unexplained weight loss occurs through two mechanisms. The first is the tumor's metabolic demands. Cancer cells are metabolically hyperactive. They consume glucose and amino acids at a rate that competes with the body's other energy needs. They alter the metabolic environment of the colon in ways that reduce nutrient absorption efficiency. The second mechanism is cytokine-mediated loss of appetite. The chronic low-grade inflammation surrounding a tumor releases proteins that suppress appetite at the central nervous system level. The body's hunger signals are dampened by the inflammatory response. The result is that the person eats less without fully registering why, loses weight without changing their habits, and attributes the loss to being busy or to finally eating better. Unexplained weight loss in adults over 60 is one of the most clinically significant warning signs in all of medicine. It is not specific to colon cancer. It can reflect a range of conditions, from other cancers to thyroid disease to depression. But its nonspecificity does not make it less urgent to investigate. It makes it more urgent. Any unexplained weight loss of 5% or more in a senior should trigger a full workup that includes, at minimum, a complete blood count, metabolic panel, thyroid function, and, if other causes are not identified, a colonoscopy. There is something I want you to do right now if you are watching this and recognizing two or more of these signs in yourself. I want you to write down each symptom when you first noticed it and how often it occurs. Then, I want you to call your doctor tomorrow morning and use these specific words. I have noticed some new gastrointestinal symptoms that have been present for more than 2 weeks, and I would like to be evaluated. Those words flag the clinical concern without requiring you to diagnose yourself. They give your doctor the information they need to order the right tests. Do not wait for your next annual physical. Call tomorrow. And if you want the follow-up video where I cover exactly what a colonoscopy preparation involves and how to make it as comfortable as possible, subscribe right now so it comes directly to you when I release it. The seventh warning sign is the one I want to spend the most time on because it is the one most completely overlooked, not just by patients, but by doctors. It is a change in the color or character of stool without obvious dietary explanation. Most adults have never been taught to pay attention to their stool. The topic is uncomfortable, but your stool is one of the most direct readouts your body gives you of what is happening in your gastrointestinal system, and changes in it are clinically meaningful. What you are looking for is this: a persistent lightening of stool color. Pale, clay-colored, or gray stools can indicate a disruption in bile flow, sometimes related to a mass pressing on the bile duct or liver involvement. Dark brown to black stools, again in the absence of iron supplementation or bismuth-containing medications like Pepto-Bismol, can indicate upper gastrointestinal bleeding, as I described earlier. Stools that are consistently thinner than usual, what clinicians call pencil stools, indicate partial luminal obstruction, meaning something is narrowing the passage. Mucus in the stool, present consistently rather than occasionally, can indicate that the colon lining is being irritated or disrupted by a mass, and stools that float more than usual, or that are particularly difficult to flush, can indicate changes in fat absorption related to altered bile metabolism. None of these individually are diagnostic. All of them, in combination with one another or with other signs on this list, form a pattern that deserves clinical attention. The reason I include this as a distinct warning sign is that it requires something specific from the person watching this. You have to pay attention. That is the entire ask. Look, notice, note when something changes. A 30-second observation at a moment that already exists in your day costs nothing and carries no downside. Now I want to address something directly because I know it is on the minds of a significant portion of people watching this. Colonoscopy, the word that stops people from acting on every single warning sign I have just described. The procedure that an estimated 40% of adults over 50 who should have had one have never had, specifically because of fear, embarrassment, inconvenience, or the perception that the preparation process is intolerable. I want to give you the actual numbers because I think the fear is disproportionate to the reality. A colonoscopy takes between 20 and 45 minutes. The procedure itself is performed under sedation. The majority of patients have no memory of it and experience no discomfort during the procedure. The preparation, the bowel cleansing that happens the evening before, is the part people dread most. It has improved significantly in the past decade. Newer low-volume preparations require drinking substantially less liquid than older protocols. The day of the procedure, you are sedated, you wake up, you are discharged within an hour in most cases, and you can return to normal activity the following day. The risk of a serious complication from a diagnostic colonoscopy, meaning a colonoscopy where no intervention is performed, is approximately 0.1%. That is 1 in 1,000. The risk of dying from colon cancer, if it is caught at stage 3 or later, is over 50%. The calculus here is not difficult, and for people who genuinely cannot or will not undergo colonoscopy, there are alternatives. A fecal immunochemical test and FIT test can be done at home, requires no preparation, detects blood in the stool with reasonable sensitivity, and requires only a stool sample collected privately and mailed to a laboratory. A CT colonography, sometimes called a virtual colonoscopy, images the colon with computed tomography rather than a camera and requires no sedation. These are not equivalent to colonoscopy. They miss some polyps that colonoscopy would catch, but they are substantially better than nothing, and for people who would otherwise have no screening at all, they are a meaningful step. The point is this: every single warning sign I described today has a next step available to you. You do not have to guess. You do not have to wait. You do not have to decide for yourself whether what you are experiencing is significant. You call your doctor, you describe what you have noticed, and you allow the clinical process to determine whether further investigation is warranted. Your job is not to diagnose yourself. Your job is to notice and report. Let me give you a complete summary of the 7 signs. A persistent change in bowel habit lasting 2 weeks or more. Looser, firmer, more frequent, less frequent, or a change in the shape of stool. Rectal bleeding or blood in the stool, visible or suspected based on stool color changes. Unexplained fatigue consistent with iron deficiency anemia. the fatigue that sleep does not resolve and that has developed gradually over months, new persistent abdominal discomfort, cramping, bloating, or a sense of fullness, not clearly linked to specific foods, a persistent feeling of incomplete evacuation after bowel movements, unexplained weight loss of 5% or more over 6 to 12 months without a clear cause, and changes in stool appearance, color, width, consistency, or the presence of mucus, persisting over weeks without an identified dietary explanation. If you have one of these signs, mention it to your doctor at your next appointment. If you have 2 or more, call tomorrow and ask to be evaluated specifically. Do not wait for annual physical scheduling. The window between early and advanced staging in colon cancer is a window worth fighting to stay inside. I want to end with something I think is important. Colon cancer is one of the most preventable and most treatable cancers in medicine when it is caught early. It is also one of the most deadly when it is caught late. Not because it is biologically more aggressive than other cancers, but because it is so consistently caught late by people who had warning signs they did not recognize or did not act on. The research on this is clear. The tools exist, the screening options exist, the treatment for early-stage disease exists, and it is highly effective. The only gap between what medicine can do and what actually happens is information. Information reaching the right person early enough to matter. That is why this channel exists. If this video found you at the right moment, if something I said today made you decide to make a call you have been putting off, please share it. Share it with the person in your life who has been noticing something and dismissing it. Share it with the adult child whose parent refuses to talk about their health. Share it with anyone over 50 who has never had a colonoscopy and keeps finding reasons to delay. One share could move someone's diagnosis from a conversation they dread to a conversation that saves their life. Subscribe to this channel if you have not already. My next video covers the specific dietary patterns that reduce colon cancer risk, the foods, the amounts, and the mechanisms that researchers have identified as protective, and the foods that the evidence suggests accelerate polyp growth. That video is coming next week. Subscribe so you do not miss it. I am Dr. Edward. Pay attention to your body, act on what it tells you, and I will see you in the next one.